When I got called, I was like, in disbelief a little bit. You want to evacuate? I got a call by my charge nurse in labor and delivery, and so then I called the supervisor and checked in with her, and she was like, oh yeah, there's a really bad fire. And she sounded panicked, and this supervisor doesn't usually sound panicked. So I said, do you want me to help make calls? And she said, yeah. So I called these two and told them what was happening from the best of what I knew, and then got in my car and headed here, and then I saw the fire.
For me, with the evacuation, when I got the phone call, I got dressed and headed on in. I couldn't make it, but that was kind of a blessing because I ended up turning around and going to Memorial, and I was able to help set up because there was only 2 nurses there with 1 baby, and there's no way 2 nurses could have set up for 8 additional patients and taken the care of 8 additional patients.
I live in Guerneville, so coming from Guerneville here, it's weird because it's fine in Guerneville. There's no wind, there's no smoke, there's no fire. And I'm in the car, okay, Julie says the house was on fire, and I'm driving, and then as you get up over, like towards Fulton, that's when you see this weird orange band.
Well, and I think that was what was really confusing. I mean, not only is it the middle of the night, but there were fires everywhere.
Yeah.
Mm-hmm. It took someone saying, there's like 20 fires around us for it to click.
Yeah.
What the staff was doing down here when I got here was that we are prioritizing, okay, who's our sickest patient, which is the best way to travel for them, and then we kind of went down that path, got all the information that we could, with their HMPs, any kind of medical record, any of that kind of information to travel with them. And then we brought that information up to the command center so we knew how many ambulances, how many were going to go via buses, etc. So that's...
And then when they started taking the patients out of the unit, it went smooth. One after another, we get a call. If there's another ambulance here for your labor delivery patient, you can bring her down, and this is where this one's headed. And so we knew which patient was going where, and then the babies also.
Yeah, and I think another key point is we had people who were willing to think outside of the box. Getting a bus, that's genius. I mean, you don't have to wait for one ambulance to transport one person. Same with the babies. We had car seats. We put them in the car seats. Off they went. We could get 3 or 4 in an ambulance at a time that way.
Our front hall's full of glass. You can see out there. So try to keep the blinders on.
If you were up on the 2nd level, you could get a view, but you could see the flames. Mm-hmm. So, and then you could see Wells Fargo. Yeah. I had no clue what was going on between Wells Fargo and the front. The only thing I knew about the winds was when I walked in, but the embers, those big fireballs that were blowing across the parking lot, I had no idea that was going on. Yeah. I didn't see some of the fire trucks until I saw the video that there really were people out there helping us. We were in here taking care of the people here, and that was what my focus was. My job was that night was that I was asked to circle where the evacuees were. So I kind of just kept circling the bistro, checking in with them. How are you doing? What do you need? Can I get you some water? Just reassuring them that we're doing everything in our power to keep you safe, and any next steps that were coming as we're getting it from our command center. These evacuees were true evacuees. They barely escaped with their lives for some of them. Some of them lost their homes, maybe lost their pets, no clothes, no shoes, and had no idea what the next steps were for them. My staff never wavered. They never panicked. They didn't look stressed. They didn't even bring it up. At one point, when we had everything lined up about who we were transferring, where they were going, we really didn't have contact either. So somebody went online and pulled up, one of the something on the internet, and 2 of the nurses discovered that, that's near my area, and they very casually just said, I wonder, if I'm going to have a home to go to. But this was a tight-knit group on the night shift. They worked very well together. They decided who's going to go with what patients, because that was the other part, too, that these nurses didn't just get to go home and the patients left. They went with their patients and then had to figure out how they were going to get home.
I'm just amazed still by my nurses and how they just kept it together, not even knowing if their family was okay and their house was still standing. And, I mean, it just speaks volumes what they did for our community and our patients and the dedication that they have.
This is a great team. I'm proud of my nurses. I'm extremely proud of them. I'm extremely proud of the leadership that I knew they have it. I've seen it before, but they rose to the occasion, and I couldn't be more proud of them.
Yeah. I was impressed by our internal community. Like we knew we have a great leadership team, but they really came together and we got to know each other better. And you really see the level of dedication and commitment here is outstanding.
Yeah.
You know,
outstanding.
The week, you know, from the fire until we opened, everybody was here, no matter what was happening on their own personal level, because we knew this was a priority for the community to get open, for our staff to get this place open, and well, we got to work through it. We can't just move on. We need to work through it. It's gonna be tough. Our community's changed, and it's gonna be changed for a while. But as that was a hashtag Sonoma Strong, you know, we're gonna build it back, and we have each other, and that's the big picture here.